great to be here. Recognize a few people worked as on set for 30 years in the NHS, then moved into various other lines, including employee mental health, and now working with parents of kids. Can you hear?
Yeah, it's afternoon.
Okay. So after 30 years in the NHS here, working with employee mental health and also with parents, children with neurodiversity, and I'll mention a couple of those things in my talk, but sound here?
Yeah.
So, there's a lot to cover, and we had promised to finish it early, and I'd have a few extras. It's going to be fewer minutes. So today, I will be.
That's what.
Okay. Yeah. So that's me. You can discuss what I'm doing. So today, what I'll be covering is what we mean by the term resilience, considering why men's health outcomes are worse than women's health outcomes, and how this is related to the way in which masculinity is defined in our society. And I will also consider alexithymia, emotion suppression and neurodivergence, before focusing on how to develop resilience, and how this is a really useful, or I propose it's a very useful framework for our work. First of all, can you think of some synonyms for the word resilience, other words? I'm not going to use Mentimeter. On your table are some little notepads, Haynes Museum notepads, and there are pens. Could you just keep those to hand for a little exercise, so I might go along. But here, just try the person next to you and see what words come to mind, other than all ones So, what words come to mind when you think of resilience? The answers have all been revealed. Actually, there's potential synonyms. And if you came up with any of those in those instants, like a brain turned to this, then well done. The ones that I like are there on the left. And the definition that I found helpful is one from the American Psychological Association. Resilience is the process and outcome of successfully adapting to difficult, challenging life experiences, especially through mental, emotional, and behavioral flexibility, and adjustment to external and internal demands. You've taken the fine-tuning in the slides off as well, I see.
Yes.
So, where did the term come from? It started off, first of all, being used in the kind of materials field, and that's a picture of a skyscraper. That's the Burj Khalifa, and most people may know that's the tallest skyscraper in the world. And skyscrapers flex; they move. They can move up to a couple of feet at the top, and so they're not just rigid. They're not just strong. They're not just solid. They also have to have flexibility built in, and you can see the sort of things that they do to make them flexible. I learned these preparing for this talk, but they have all kinds of counterweights and different kind of frames and shock absorbers in the foundations, all to enable these buildings to flex. So they can cope with the high winds, they can cope with the earthquakes and such like. And so the key in this concept is that it's not just strong, but also there's the ability to bend, to flex, to cope with the environment, to respond appropriately. And that idea was taken forward first in the mental health field and then in the physical health field. And of course, in the mental health field, we've been thinking for a long time about why do some people develop mental health problems and not others. Two kids in the same family, one might develop mental health problems, the other not. They've been through pretty much the same experience growing up, they have pretty much the same genetic inheritance. So we've always been interested in it. And it's not just the genetic inheritance which is key, it's also early life experiences. Some of you may have heard of the ACEs. The adverse childhood experiences is a very interesting research field, which points to quite simple questions about people's childhood up to age of 18, abuse, neglect, growing up in chaotic circumstances. Those are the sorts of factors which are strongly correlated with subsequent mental health problems and also physical breakdowns. But it's not just those early experiences that are potential risk factors. It's the balance between the risk factors and the protective factors that's key to understanding why somebody will go into develop mental health problems and also physical health problems. And before I talk about the biopsychosocial model a little bit, I'd like you to use that notepad and see how many of these positive childhood experiences you would say you've had in your childhood. Now, you're not going to share this. The previous exercise, which we skipped over, was a chat to your neighbor to get to know them a bit. But this is personal, it's potentially sensitive. So take part in this as much as you wish to. But these are the positive experiences that you've had. And these are the factors which are protective of your mental health. Now, this is from one of the questionnaires which has been relative for there's a flip side to the adverse childhood experiences death. Just go through those 7 questions on the right and just tick off how many of them apply to you. I'll give you a few moments to do that. Give that some thought.
So you write down the ones that you felt you experienced as a child.
So you had a chance to read through those 7. I know it's probably deserves a lot more time than we're giving it now. But that gives you some sense of some of the factors that research have found are linked with boosting your resilience. Okay? We're not going to go through a whole personal analysis in my talk today. But I just thought it was interesting to take note of that. And of course, even if you've had a rough start in life and had lots of adverse experiences, these are the things which rebalance the scales. What's very interesting, that original research with the ACEs, it was 12.5% of the samples, the large study, had 4 or more of these ACEs. Again, this is 10 questions. And those people, that group that had 4 or more, was found to be 260 times more likely to have COPD, that's chronic obstructive pulmonary disease, 240 times more likely to contract hepatitis, and 460 times more likely to experience depression. So it's a really simple tool, but really powerful once it's tapping, and this has massive implications, very much in line with the theme of this conference. And why like this thing? Well, I don't have time to go into that in detail, but we know that stress affects our body in a very fundamental way. It does a lot more than this, but you get flooded with cortisol and adrenaline. Your body is enabled to flee or to fight. And if that high stress level continues, it's there repeatedly, continues over long, it's there in your system, is still forming, your child, then it becomes a problem. And of course, trauma is the word we use for extreme stress. And you may have come across Bessel van der Kolk's book, The Body Keeps the Score. We know that what is happening is not just up here, it's not just a mental thing, it's a whole body experience. And we know that when people have trauma, even if they repress the memories of that traumatic event, they can no longer bring to mind what they went through when they were attacked or whatever. A awful thing happened to them. The body still holds those memories, if you like, and it can be re-traumatized, re-triggered again. So biopsychosocial model is worth thinking about, and often psychologists make use of that. It's thinking about the biological factors, psychological factors, and the social factors, which can affect those scales. And For instance, sleep, I won't go through the whole thing at a time, but sleep can be both protective if you get good sleep, but also if you have poor sleep, both physical and mental health problems are much more likely. Okay. This is a resilience scale. It's one of many. I'd like you to have a quick go at this one by take stock of the time and see whether you could score yourself on these 6 questions. And this is one of many resilience scales. But try and do this as quickly as you can. So, questions 1 to 6, what score would you give yourself? Looking at the scores on the right. Scoring alternates. Just have a quick go at it.
Can you read them out? I haven't got my glasses with me.
Okay. First question. I tend to bounce back quickly after hard times. If you strongly disagree, that's the left-hand side, then it's a 1. If you are neutral, it's a 3. If you strongly agree, it's a 5. I tend to bounce back quickly. Number 2, I have a hard time making it through stressful events. Here, the strongly disagree is a 5, and the strongly agree is a 1. Question 3, it does not take me long to recover from a stressful event. Strongly disagree is a 1, and the strongly agree is a 5. Question 4, it's hard for me to snap back when something bad happens. Question, strongly agree on the left is a 5, and strongly agree is a 1. Question 5, I usually come through difficult times with little trouble. Left-hand column is a 1, strongly disagree rather, and strongly agree is a 5. Final question, I tend to take a long time to get over setbacks in my life. Strongly disagree is a 1. We'll see if this exercise works at a conference like this, but I'd like you to add those scores up if you've done the exercise, and if you want to interpret that score, then the interpretation is on the right. You have, basically you get an average of those scores. So total divided by 6, including the average score. And if you're below 3, that indicates you're in the category to do with low resilience. And if you're above 4.5 rather, then it's high resilience. Okay, it's a very simple scale, and that's the way in which it's interpreted. That's the score. These are the norms used to make sense of it. Okay, so this is something you're keeping private, but it's something for you to reflect on. And there are more exercises later in the day to do with your own resilience. Why is this important? Well, I won't go into the details, but there are large-scale studies, it's not just a few little studies, which point out that anyone scoring below 3, there's a much higher likelihood of a whole lot of physical and mental health issues. So this is a strong correlation between this endorsing that kind of bouncing back ability in that previous scale and subsequent problems developing. So it's really an interesting research to be aware of. And there are other scales as well. The previous one was very unidimensional. There are other dimensions captured in other resilience scales. And there are some examples there. So for instance, social support or having a sense of purpose are the kind of things that other scales are also teasing out, if you like, the components of resilience. I'll talk a bit more about developing resilience, but you'll recognize some of what I present later in relation to some of these cholesterol here. What's interesting is the one I put in capitals at the end of the personal resilience indicator on the right-hand side. That is the emotional executive balance. So this is the kind of how effectively someone integrates their emotional awareness with their rational thinking, their cognitive clarity. And getting that balance right. Too much of one or too much of the other is unhealthy. So I won't go through this slide. You heard Neil presenting statistics earlier. I will talk about externalizing and internalizing very briefly. what's interesting is that in the way in which people present to mental health services, boys tend to present with conduct disorders, behavioral issues, and girls present with lower mood or anxiety. It's not the absolute, it's not cut and dried, but it's 10 to 15% of boys present with those externalizing problems, and only 5 to 10% of girls present with those problems. And then the reverse is true for the internalizing disorders. So with the anxiety depressions, it's 5 to 10% in the boys, but for girls it's 10 to, in fact, 20%. It gets to be more severe. Greater proportion of girls present with the internalized symptoms as they go to adolescence. And this is continued into adulthood. So it's the men we heard earlier present with the substance misuse, conduct issues in particular. So it's not absolute, but what is this about? Some of the common factors appear to be to do with the aversion to seeking care, stoicism, emotionlessness, and invulnerability, and shame therapy. So stoicism, that's the small s of the Greek philosophy, Hercules. That's the endurance of pain or hardship without complaint. The emotionlessness is perhaps the more concerning part of that picture. That's that numbness, that being emotionally cut off, being very well defended, impregnable. That is very unhelpful towards mental health. And often this is driven by shame, the fear of being judged, being weak for showing emotions.
5 minutes, right?
So there's research showing that men are less likely to seek help. If they adhere to these norms around stoicism, then they're more likely to not be able to present and describe this to do with depression and other mental health problems. And that men tend to distract themselves and avoid the problem rather than admitting any weakness or seeking help. So they're at risk of double jeopardy. They're more likely to develop mental health problems, and also they're less likely to seek help. So that, I think, is a really important one to focus on. I'm going to skip through some slides. Very briefly, what's interesting is that there's been a lot of focus on alexithymia, or the inability to identify, to name, and to express emotions. And initially it was seen to be mainly linked to autism. But actually it's not that distinctive. Autism, about 50%. People with autism have that difficulty. It's also the case that it happens with people with ADHD, who figures are not about 25 to 50%. And actually in the normal population, it's much more prevalent than we thought, 10 to 15%. So it's an interesting area to focus on. I'm not going to go into it in detail now, but it is also not just simply due to genes. It's also seen to be more extreme in environments where kids grow up, where this is a message they get from their parents, particularly from their fathers. And you can teach emotions. We do this at Assembly. I'm working now with the parents. And they can learn the distinctions. Often, people just know angry, sad, and happy, but there's a lot more emotions than that. It's about 8 or 7. Some foundations of resilience. Optimism, self-esteem, self-efficacy. Those different personal qualities which are really key to resilience. Emotion regulation skills, so being able to identify emotions and process them, but not be overwhelmed by them, not be completely flooded by emotions, and unable to think. Flexibility of thinking. It's really difficult to be resilient if you're very rigid thinking. And of course, some kids are more likely to be flexible from the start, and some more likely to be more rigid. But again, it's something that we can all work on as children or adults. Feeling safe enough to open up about your feelings, to kind of process them, make sense of them, to story them, put them into your life story, to integrate those traumatic experiences and ask for support and help. And of course, also receiving that support and understanding and encouragement to deal with the issues rather than sweeping them under the carpet. Or, which you haven't said. And actually, it's encouraging to see that there is an evolving concept of masculinity. Maybe 2 steps forward or 1 step back, but I think we're starting to detect these changes in society. But it's being recognized that it actually is very difficult to show vulnerability or to express your flaws, and that takes bravery to do that. And that's a reframe which I think is taking hold. So there are lots of ways of building resilience. I'm going to skip over these rather than discuss them in detail, but as you can see, this is the kind of thing that can be done. Starting with physical well-being, mentioned emotional regulation, strengthening social connections is really important, building those supportive relationships, enhancing cognitive flexibility, finding meaning and purpose. If you have that meaning and purpose, then you're more likely to be able to continue on your life's journey when things get tough. To storyboard your life, to have that sense of narrative arc, story of your life. Cultivating mindfulness and self-awareness. Developing effective coping and problem-solving skills, and really important, self-compassion, treating yourself with kindness. We're often our own worst critics. And embracing setbacks, kind of the normal part of personal growth. We're not a disaster. So, to finish, I think it's actually a very appropriate banner under which to have mental health and physical health initiatives, especially for men. Taps into that sense of what men in our society are taught to value. But I think it's, because of course it's something that good value to. But in the men's conference, it seems particularly appropriate. It conveys a different kind of strength, a kind of inner and outer strength that valuing your grit and adaptability, a willingness to be emotionally present, be there for others, and accepting of help. It's a more holistic kind of including all aspects of life, way of thinking about things, presenting things. And so it's a good banner for prevention, large-scale initiatives, population initiatives, but also early intervention, nipping problems in the bud. And also, I think it could be used in treatment and therapy. And so it's suitable, I think, for all contexts, including many of you here with an employee mental health kind of hat on, with employees.